If you're a senior, or if you love a senior, I need you to stay with me for the next few minutes, because what I'm about to tell you about three very common medications that are sitting in millions of American bathroom cabinets right now, could save your memory, save your independence, and possibly save your life. These are not rare drugs. These are not experimental medications. These are pills that doctors prescribe every single day, and many of them are available over the counter. And yet, decades of medical research has now clearly shown that these three categories of medications are directly linked to memory loss, cognitive decline, and even a significantly increased risk of dementia when taken regularly by seniors. My name is Dr. Ray, and today I'm going to walk you through each of these medications in detail, explain what they do to your brain, and tell you what safer alternatives exist. Please don't skip this video, and please don't stop taking any medication without talking to your doctor first. Let's begin. I want to start with a patient story, because this is how I first truly understood how serious this problem is. Her name was Ellen, 79 years old, sharp, witty, a former accountant who could still do arithmetic in her head faster than I could type it into a calculator. Her daughter brought her to see me because Ellen had been declining noticeably over the past 2 years. She was forgetting conversations. She was getting confused about her medications. She had twice left the stove on. Once she got lost, driving home from the grocery store she'd been shopping at for 20 years. Her doctor had told the family that Ellen likely had early Alzheimer's disease and had started her on medication for that. But when I sat down with Ellen and her daughter and went through every single pill Ellen was taking, a striking picture emerged. She was on an older antihistamine for allergies. She was on a sleep aid that contained the same type of compound. And she was on a medication for overactive bladder. 3 medications, 3 different conditions, but all 3 belong to the same class of drugs called anticholinergics. And anticholinergic drugs are known to cause severe cognitive problems in seniors. With her primary doctor's cooperation, we carefully tapered her off of these medications over a few months. Within 6 months, Ellen's memory had dramatically improved. She was back to her old self. She didn't have Alzheimer's at all. She had drug-induced cognitive impairment, which is completely different and completely reversible. I tell you this story because I want you to understand something very important. Many seniors who are told they have dementia actually don't. They have medication-induced cognitive problems that look exactly like dementia, but that can be reversed if the offending drugs are removed. And the tragic thing is, most doctors don't check for this. They just assume any memory loss in a senior must be Alzheimer's or some other irreversible condition, and they prescribe dementia medications on top of the medications that are actually causing the problem. This is a silent epidemic, and nobody is talking about it enough. So let's get into the 3 categories of medications that are the biggest culprits. The first category is anticholinergic drugs. These medications work by blocking a chemical called acetylcholine in your body. Acetylcholine is critical for memory formation, learning, and clear thinking in the brain. When you block it consistently, especially as a senior whose acetylcholine levels are already naturally declining, you can develop significant cognitive problems. Anticholinergic drugs come in many forms, and this is what makes them so tricky. Many are over the counter. Common anticholinergic medications include diphenhydramine, which is the active ingredient in Benadryl, Zizquil, Tylenol PM, Advil PM, and many sleep aids. If you've been taking any of these regularly for sleep or for allergies, please listen to me carefully. Doxylamine, which is in Unisom and NyQuil, is another one. Also on this list are medications for overactive bladder like oxybutynin and tolterodine, sold under brand names like Ditropan and Detrol. Certain antidepressants, particularly older tricyclics like amitriptyline, nortriptyline, and doxepin, are strongly anticholinergic. Some muscle relaxants like cyclobenzaprine are also on this list, and certain medications for nausea, irritable bowel, and Parkinson's disease fall into this category as well. Large studies, including a major study published in JAMA Internal Medicine tracking over 30,000 older adults, have shown that seniors taking anticholinergic drugs regularly have a significantly higher risk of developing dementia, by some estimates up to 50% higher. And the longer you take these drugs, and the higher the doses, the greater the risk becomes. Even 3 years of consistent use at moderate doses has been linked to measurable increases in dementia risk. What should you do if you're taking one of these medications? First, do not stop suddenly on your own. Some of these drugs require careful tapering. Make an appointment with your doctor, bring this information with you, and have an honest conversation about whether there are safer alternatives. For allergies, newer antihistamines like loratadine, cetirizine, and fexofenadine have very low anticholinergic activity and are much safer for seniors. For sleep, instead of diphenhydramine or doxylamine, consider magnesium supplements, melatonin in small doses, herbal teas like chamomile, sleep hygiene improvements, or if truly necessary, short-term use of safer sleep medications under a doctor's supervision. For overactive bladder, pelvic floor exercises, bladder training, and newer medications like mirabegron often work well without the cognitive side effects. For depression, there are many newer antidepressants that don't carry the anticholinergic burden. The second category of medications linked to memory loss is benzodiazepines. These are drugs like Valium, Xanax, Ativan, Klonopin, and the sleep medications Halcion and Restoril. Benzodiazepines are prescribed for anxiety, insomnia, and sometimes for chronic pain or muscle spasms. They work by enhancing a calming neurotransmitter in your brain called GABA. In the short term, they make people feel relaxed and sleepy. But in the long term, and especially in seniors, they cause serious cognitive problems. Studies have consistently shown that long-term benzodiazepine use in seniors is associated with memory impairment, impaired attention, slowed reaction times, increased risk of falls, increased risk of hip fractures, and higher rates of dementia diagnosis. A landmark Canadian study found that seniors who had taken benzodiazepines for more than 6 months had roughly a 50% higher risk of developing Alzheimer's. And yet, benzodiazepines are still prescribed routinely for seniors. Many seniors have been on these medications for years, sometimes decades, because it's easier for doctors to refill the prescription than to help them get off it. If you're on a benzodiazepine, please know that these drugs are genuinely difficult to stop. You cannot just quit them suddenly. Doing so can cause severe withdrawal symptoms, including seizures, and can be dangerous. You must work with your doctor on a very slow, gradual tapering plan, sometimes over many months. But the good news is, once you're off these drugs, cognitive function often improves significantly. For anxiety, safer options include cognitive behavioral therapy, which has excellent evidence for older adults, certain antidepressants that can also help with anxiety, and lifestyle approaches like exercise, meditation, and reducing caffeine. For insomnia, the same alternatives I mentioned before apply, along with cognitive behavioral therapy for insomnia, which has been shown to work better than sleep medications in the long run. The third category of medications I want to discuss is proton pump inhibitors, commonly called PPIs. These are drugs like omeprazole, Prilosec, Nexium, Prevacid, and Protonix. They're prescribed for acid reflux, heartburn, and stomach ulcers, and they work by dramatically reducing stomach acid production. Millions of seniors are on PPIs, and many have been taking them for years or decades, but recent research has raised serious concerns about their long-term safety. Multiple large studies have now linked long-term PPI use to an increased risk of dementia, by some estimates up to 44% higher in heavy users. Why? Several mechanisms are at play. First, PPIs reduce your body's absorption of vitamin B12, and B12 deficiency causes cognitive problems, including memory loss, confusion, and even dementia-like symptoms. Many seniors on PPIs have undiagnosed B12 deficiency that's contributing to their cognitive decline. Second, PPIs appear to affect brain enzymes involved in clearing beta amyloid, the protein that builds up in Alzheimer's disease. Third, they can alter your gut microbiome in ways that promote systemic inflammation, which affects the brain. And fourth, they reduce absorption of magnesium, calcium, and iron, all of which are important for brain health. If you've been on a PPI for more than a few months, please have a conversation with your doctor about whether you still need it and whether you could try tapering off. Many people take PPIs for acid reflux that could actually be managed with dietary changes, weight loss, elevating the head of the bed, avoiding trigger foods like coffee, alcohol, tomatoes, chocolate, and spicy foods, and not eating within 3 hours of bedtime. For occasional heartburn, simpler medications like calcium carbonate tablets or H2 blockers like famotidine are generally safer for long-term use than PPIs. Stopping PPIs abruptly can cause rebound acid hypersecretion, where your stomach produces even more acid than before. So work with your doctor to taper slowly, possibly switching to an H2 blocker as a bridge and making dietary changes at the same time. If you have to stay on a PPI for a medical reason like Barrett's esophagus or chronic ulcers, make sure you're supplementing with B12 and having your levels checked regularly. Now, I want to address some other medications that, while not in my top 3, are also worth discussing because they're commonly linked to cognitive issues in seniors. Statins, the cholesterol-lowering drugs, have been linked in some patients to memory problems and cognitive fuzziness, although the research is mixed. If you've noticed cognitive changes after starting a statin, talk to your doctor about whether a different statin or a different approach might be appropriate. Opioid pain medications, even when taken as prescribed, can cause significant cognitive side effects, especially in seniors. Muscle relaxants as a whole class carry cognitive risks. Some blood pressure medications, particularly beta blockers, can cause fatigue and mental fog. And high doses of medications for Parkinson's disease can sometimes cause confusion. Here's my practical advice for any senior or family member of a senior. First, make a complete list of every medication you take, including over-the-counter pills, supplements, and herbal remedies. Write down the name, the dose, the reason you take it, and how long you've been taking it. Second, bring this list to your doctor for what's called a medication review. Ask specifically, do any of my medications have cognitive side effects? Are there safer alternatives? Can any of these be reduced or eliminated? This conversation is called deprescribing, and it's one of the most important conversations a senior can have with their doctor. Third, be suspicious of any new cognitive changes and always consider medications as a possible cause before accepting a dementia diagnosis. If you or a loved one has recently started a new medication and then experienced memory problems, confusion, or mood changes, the medication is a very likely culprit. Talk to the doctor about this before assuming something worse. Fourth, never combine multiple drugs from the anticholinergic category, which is a major risk. Many seniors unknowingly take 3 or 4 anticholinergics at once, one for sleep, one for allergies, one for bladder issues, one for depression. The cognitive burden adds up dramatically. Fifth, be your own advocate. Doctors are busy. They often don't have time to fully review every medication on every visit. If your doctor dismisses your concerns, consider getting a second opinion, ideally from a geriatrician, a doctor who specializes in the care of older adults. Geriatricians are specifically trained to manage medications in seniors and to avoid the polypharmacy problems that regular doctors often miss. Sixth, investigate your symptoms. Keep a journal of when you started each medication and whether any cognitive symptoms followed. Sometimes the timing makes the culprit obvious. And seventh, don't underestimate the power of lifestyle medicine. Regular exercise, quality sleep, stress management, social engagement, cognitive challenge, and good nutrition are all far more powerful than any pill for protecting your brain. Medications should be a last resort, not a first response for many of the problems seniors face. Let me also address something important. I'm not anti-medication. Medications save lives and can improve quality of life tremendously. But all medications have trade-offs, and in seniors especially, the trade-offs are often worse than the benefits. The body processes drugs differently as we age. The liver and kidneys slow down. Medications stay in the system longer. Side effects are stronger. Interactions are more common. What was a reasonable prescription at age 50 may become harmful at age 70. So periodic medication reviews are essential, and the answer to every health problem is not always another pill. If this video has been helpful, please share it with someone you love, especially if they or a family member has been struggling with memory issues. This could be the information that changes their life. Subscribe to this channel, and in the comments, share whether you've ever experienced cognitive changes after starting a new medication. Your stories help educate others. Before I go, my standard disclaimer: I am not your personal physician. Never stop any medication without consulting your doctor. The information I've shared is educational and based on published medical research, but your individual health situation may require medications that have cognitive side effects because the alternative is worse. Only your own doctor, who knows your full health picture, can guide you on what's right for you. Take care of your mind. It's the most important thing you have. And I'll see you in the next video. Let me add a few more important things before you go, because this topic is too important to leave incomplete. First, I want to talk about how to have this conversation with your doctor without offending them. Some seniors feel intimidated or worry about challenging their physician's prescriptions. Let me give you some language that works well. Try saying, "Doctor, I've been reading about how some medications can affect memory in older adults, and I'm wondering if we could review my full medication list together to make sure everything is still appropriate." Most good doctors will welcome this conversation. If your doctor becomes defensive or dismissive, that's a warning sign that you might benefit from a second opinion. Second, bring every single pill bottle with you to the appointment, including supplements, vitamins, herbal remedies, and over-the-counter products. Don't just bring a list. Bring the actual bottles so your doctor can see exactly what you're taking and at what doses. Many seniors are surprised when their doctors point out interactions or redundancies they hadn't noticed. Third, pharmacists are an underused resource. A good pharmacist can review your medication list in detail, often for free, and can identify problems your doctor might have missed. Medicare covers medication therapy management for many seniors, which is a formal service to review medications for safety and effectiveness. Ask your pharmacist about this. Fourth, be careful with sample medications. When doctors give you free samples, they often don't record them in your chart, which can lead to problems later when another doctor doesn't know what you're taking. Always write down any medications you're given, including samples. Fifth, watch for the prescribing cascade. This is when one medication causes a side effect, and a doctor prescribes another medication to treat that side effect, which causes another side effect, which leads to another medication. Before long, you're on 10 drugs when you really only needed one. If you're on more than 5 medications, this is a huge red flag, and you need a comprehensive review. Sixth, if you have a family member with cognitive decline, please don't assume it's irreversible dementia. Always make sure a complete medication review has been done. Check for B12 deficiency, thyroid problems, depression, urinary tract infections, and drug interactions. Many seniors are labeled with dementia when they actually have a reversible condition. I cannot tell you how many times I've seen families accept a dementia diagnosis only to discover later that their loved one had a fixable problem all along. And seventh, stay informed. Medical knowledge is constantly evolving, and what was considered safe 10 years ago might now be recognized as risky. Follow reliable sources, ask questions, and never assume that because a medication has been prescribed for years, it's still the right choice for you. The bottom line is this: your brain is precious, and it deserves protection. Many of the things we accept as normal aging are actually preventable or reversible. Don't give up your mind without a fight. Question your medications, advocate for yourself, and know that you have more power over your cognitive destiny than most doctors will tell you. Take care, friends, and I'll see you next time.